Welcome to this video podcast on when it is a good idea to call your equine veterinarian. Now, just to start off, I want you to imagine a day in the life of a veterinarian. Just think about this for a moment. This is what vets do day in, day out. Start the day around 5 a.m. Your veterinarian wakes up, grabs a quick bite to eat, gets cleaned up, gets dressed, grabs a coffee to go, and gets into their truck no later than 6 because they have to go out to a facility where the owner has to go to work. So the only time they were available was first thing in the morning. So you get to their place around 7 a.m. and say, this owner's Janice, and she has her 3 horses up for you ready to go because she knows she has to put them back to get to work, and you have a very busy day. You're there to vaccinate all 3. You check them. They look great. And you spend less than an hour on the farm, get your supplies out, give the vaccinations, monitor the horses, and then you go about your day. Next facility, Philippa. She's got a lameness issue. So it takes you about 25, 30 minutes to get to her place. You get onto her property. So now you're looking at 8:30 in the morning, and she brings her horse out, and you realize there's something more to this lameness than meets the eye. Do some triage and evaluation and see that that horse had a puncture wound. So this is probably something more severe than just a simple lameness. So this call is going to take you a little bit longer as the vet. And so now your appointments later in the day are going to get pushed back. So your vet's got to make a phone call. Calls their call center where they can inform the other clients that day that you're going to be running a little bit late. So let's say that call takes a lot longer because you have to call other veterinarians, referral hospital. This horse may potentially have sepsis, so has an infection that's more severe than initially thought. So there's a lot going on to this veterinarian that they didn't anticipate first thing in the morning that is pushing their schedule back. Then around lunchtime, they were going to take an hour off to gather the thoughts, make some notes, prep for the rest of the day, have to go by the vet hospital, pick up their instruments that they cleaned the day before through an autoclave because they have a castration that afternoon that they have to perform on a horse. And so they run through the rest of their day, and then at the end, maybe 5:30ish, done. Oh, got to go back to the vet hospital. All these instruments I use need to be cleaned, so you got to run, prep them for the autoclave. Let's say you get home as that vet around 7 p.m. And whether you have a partner or not, let's say you had a partner and the partner had dinner ready. He's a wonderful partner to this poor vet. And she takes a deep breath, sighs. Busy day, great day though, out loving doing what they do. But then the phone rings and it's a client. And the vet didn't even have a chance to take a bite to eat yet. And they're looking at their phone going, is this an emergency? Do I need to go or not? And those are the things that veterinarians are faced with day in, day out. They have long days. And I think that's what makes it exciting for them is that sometimes as they practice medicine, because that's what they do, they practice it, and meaning that they're constantly getting new things thrown at them from different angles. And it keeps the field of equine veterinary medicine exciting, but it is a lot of hard work. And due to those emergencies and being on call 24 hours a day, 7 days a week, we see a lot of young veterinarians choosing to get out of the equine medical field. And that is an issue. That is a problem that I think we, as not only educators, but as horse owners, we need to evaluate, when do we call our veterinarian with an emergency, and when do we maybe hold off and call them during business hours? Now, one thing I've always said, and I've been saying this since I started teaching, when in doubt, call your veterinarian. And I still stick by that, even after doing all the research into this. When do you call your veterinarian with an emergency? If you have doubts, it is worth the phone call. Then the vet can determine over the phone whether they need to rush out to your facility or where your horses are or not. Maybe it can wait till the next day. So I would always stick by that. And I just want to say I did get an email from one of the listeners or viewers, and she said her daughter is an equine vet, works very hard, loves what she does. And she said the best thing you can do to your equine vet is just thank them. Say thank you. So keep that in mind, because really you need to form a good working relationship with your veterinarian. And this is key as we discuss this podcast, and what are things that you need to think of before you pick up that phone call, because we are running out of equine vets. And I just did a previous podcast on that, where our equine vets are retiring at a rate that they're not being replaced. And after that podcast, I had people come and tell me that they have trouble getting a vet coming out to their facility because they're way out in the boonies. They're rural horse owners, and they don't have an equine vet that can service them that's not hours away. And so it's a big issue around the world. It's not just where you live, it's everywhere. So in this podcast, and please stick with me, we're going to talk about what constitutes an emergency. And so after business hours, you make that phone call to your veterinarian and say, hey, I've got an emergency. I need help. And also, I think as we go through this podcast, it's a good idea to keep in your mind that you need to develop a working relationship with your veterinarian and then ask them. Say, hey, if I have a question outside of normal 8 to 5 in a day or on the weekends, who do I call? Who is the best person? Do I call you if I have any questions or if I think I have an emergency? Because one thing we're finding out in the field of equine vet medicine is some of these equine vets are forming relationships or collaborations with other vets to handle these emergencies, because this is one of the big issues. This is one of the reasons they're getting out of the field, is because by the time they get home at 7 o'clock at night or 8 o'clock at night, they need rest. They need to mentally shut down. They need to watch their favorite Netflix show sometimes. They need to do all their paperwork and their billing and all the other things that come with being a veterinarian and running a business. And they can't do it in their trucks driving from farm to farm to farm. They try to, and they try to carve out time in the day to do that. But I think it's on us to make their lives easier. So when they do arrive on the farm and your horses are ready to go, and yeah, they want to talk to you. They love working with horse owners, but they've got to treat that horse or do what they're meant to do there. And then they got another call. They got to go. So we need to keep that in mind when we deal with them. So think about it from the veterinary standpoint. They get that phone call late at night, it could be 2 a.m, and they have to answer it, because that is part of their job and they know it. And a horse is in distress or potentially in distress, and they need to go handle that situation. And I remember speaking to my veterinarian back in the day when I was working with her, and she said, Chris, if I don't answer that phone call, they'll call my competitor. And I probably lost them as a client. Now, we know that's changing today, and as I record this in 2024, where veterinarians are telling their clients, in emergencies, call this person on these days, or call me, or they have a referral service, or in certain parts of the world, they are setting up emergency equine clinics that only handle emergencies. So things are changing. At the end of this podcast, I'm going to talk about telemedicine. That is something new that veterinarians are starting to use and implement, and it is changing a little bit, which is good because it's helping our equine vets with their caseloads, but there are some concerns with it. So at the end of this podcast, we're going to kind of go into telemedicine, what it is, and how it's changing the face of equine veterinary medicine. Okay, so today we're going to be giving some guidance in what to call or when to call, what situations to call your veterinarian. Before we get going, I think whenever we think of calling your vet for anything or thinking something's not right with your horse, so we need to know what is normal. What is normal for a horse before we go, something's not right, and then go, this is an emergency or this is not an emergency. When do I call my veterinarian? Immediately, or can I wait till the next day? So, what's normal for your horse? Well, we're going to talk about normal behavior and then the vital signs. What are they and how do you take them? Now, when I get to normal behavior of a horse, there are two previous podcasts if you really want to learn more, because I don't have time to cover all of it in this podcast, but signs your horses are happy and then a day in the life of a horse. Both are describing what's normal behavior for a horse and then signs that, yeah, okay, your horse is healthy and happy. Both important, especially when you're evaluating health. But whenever I talk to horse owners about what's normal or normal behavior, it's normal behavior for that horse. I mean, we even talked about personalities a few weeks ago, how different horses react to different stimuli. So, what is normal for your horse? Only you can answer that because you watch him day in, day out, or your friends or family, whoever works with that horse all the time, they know what's normal. And then they can go and say, something's not right. So, generalities, what's normal for a horse? Well, I did a study a few years ago comparing time budgets of pastured horses compared to wild donkeys, which are the Somali wild ass. Those are the original wild donkeys, and then Grevy zebra. And we just looked at time budgets. What do they do during the day? And this study, what that we looked at with horses, the data is very comparable to all the other studies that looked at time budgets of horses. But when I looked at this study, feed forage, 67% of the day, our horses that were out in pasture, they were feeding and foraging. And this was done at the University of Florida, our large farm in Ocala, where we observed these horses all day long. And close to 70% of the day, they were just munching food. Then the other majority of the day, about 18, 19%, was just standing. Okay, so that's probably resting, bouts of sleep, things like that. Social behavior was only about 2% of the day. And then locomotion was about 4 to 5% of the day. And usually it was as they were moving to new patches of grass. But what's normal for a pastured horse is feed forage. They are just moving and foraging all day long. That's what they should be doing. That's normal behavior. And social behavior, 2% aggression was very, very little, less than 1%. Any sort of aggressive behaviors, things like that. Then we looked at stalled horses. So many studies have looked at this where they're feeding. It just depends on how much hay they have, but you're looking at 10, 15% of the day, maybe 20% of the day they're feeding or eating, if you have hay. It's one of the reasons we're saying we want to provide free choice hay to horses more these days. So if they are stalled, they're spent more time foraging, feeding like they would out in pasture, or using hay nets, things like that. Standing around, that's a lot what they did, or just observing, watching what's going on around the barn. And then you start seeing these stereotypies come in, stereotypic behaviors where we see a lot more of them in stalled horses. But stalled horses, again, standing around, not laying down a lot, and and the stereotypic behaviors we do see increase, which is abnormal. But again, that's not something you would call with emergency with your veterinarian. So just kind of know what is normal for them behavior wise. Then when we look at the vital signs, first thing is temperature. Okay. Because again, if we're thinking of calling our vet, it's usually because either the horse has an injury or an illness. So, how do we know? And the vet's going to ask you, what is the horse's vital signs? And if you don't have them, then they'll probably ask you to go take them and call them back, after giving them more information. But that's critical piece of information for your veterinarian. So, if you can get it before you call them, that's very helpful to them. So, rectal temperatures is how we normally do this. You get a thermometer. You want to either tie your horse up or have somebody hold them. Then you're going to go down their left side. And I always, always just good horsemanship, always have my hand along the side of the horse. You can move their tail slightly, and then you can insert the thermometer in their rectum. Now, I always lubricate it. Some people say you don't need to. I just always do. I will tell you this: if you feel any resistance, do not push. You do not want to perforate the rectum of the horse, but just wiggle it in there. Usually it goes in just fine. Um, and then take the temperature. Now, normal is 99 to about 101 Fahrenheit, or 37.5 to 38.5 degrees Celsius. But know that horses' temperatures will fluctuate during the day. So in the evenings, they tend to be higher. So they might be a little bit higher on that scale, like 101, especially on a hot day. Or if they're exercising, obviously, when I was exercising my horses, I was getting them up over 103. And this was in the heat of Texas. So just understand that, use common sense. But if it's, middle of the day and their temperature's over 101 to 102, or 39 degrees C or above, then that horse could be running a fever. Okay. So you want to write that down, but then look at other things. Is the horse lethargic? Is it acting abnormal? Probably why you would take those vital signs, because they were. Now, the next thing is heart rate. Now, horse's heart rate normal is 30 to 44 beats per minute. Over 50 beats per minute. Again, this is a horse that has been at rest. If you go catch them in a pasture and then bring them up, walk them up to your barn, let them settle down, before you take their heart rate. Because obviously, just that you trying to catch them in a pasture or catch them in a pasture and walking up, their heart rates are going to go up. Again, common sense. When they're calm, quiet, you can listen to this. Different ways you can do it. You can get a stethoscope. They're relatively inexpensive at your drugstore or pharmacy or chemist, wherever you live in the world. You can get one of those, and you can go and listen to the horse's heart right behind the elbow, left side generally, because the heart's not perfectly centered. It's just offset a little bit in the horse. You can try to listen to it there. I always use under the cheek pulse, because the facial arteries right there. So if you go and look at the cheek of the horse and run your hand to the bottom, that curvy bony part of the back, and I just use my 4 fingers, you should be able to feel that facial artery, and then you should feel it pulsing. And I've done that. That's usually normally how I do it, because I've just always felt that was easier than pulling out a stethoscope and trying to listen. You can also, under the tail, there's an artery there you can feel, or the fetlock artery is another place. That's the digital artery that you can feel for a pulse. But I always thought the mandible was easy. And when your horse is at rest and you have them haltered, just try to feel that, and just feel, put a little bit of pressure. Don't hold it hard, please. But you can feel that facial artery, or get a stethoscope and just start practicing. And then, you can use a watch or a timer to, calculate, how many beats per minute. And again, over 50 is something's not quite right. Your horse is stressed or in distress. Respiration rate: horses take 8 to 12 breaths per minute. So that's not a lot, right? Over 30, that is usually a horse's sign of stress. Again, this is when they're calm or relaxed, when they're not, again, bringing them up to the facility or running around or after exercise. When they're just calm in a stall or tied up, sitting for a while, and they're still breathing heavily, then there's that horse is in distress. Something's not right. The way I do it, you can either look at their flanks as they breathe in and out. Remember, 1, 2, or their nostril flares. 1, 2, 3, and then you can count that way. It's really relatively easy. Then the other things you want to do is, again, when your horse is tied up or you have them haltered, is lift their lips and look at their gums, their mucous membranes, make sure they're still moist and pink. And then you want to do capillary refill time, you can just push your thumb against it, and that pink will go to white, blanch, white, and then it should refill within 1 to 2 seconds when you pull that away. If there's a delay, then that could be a big, big problem. Okay, so something again. Then hydration status, you can just do a quick skin pinch test and see if it tense. So you can pinch, and if it tense, it's going to go back in like 3 to 4 seconds. But if if they're hydrated, when you do that, it should go right back. And that means there's enough hydration in the body. So you want to do all these things before you call your veterinarian, because they're going to need this information to try to go. Again, they're doing triage over the phone, meaning they're trying to evaluate what's going on with your animal and then make decisions based on the information you're giving them. Now, obviously, if it's something which one of the most catastrophic things you can think of is a broken leg. Okay, that it's you're not going to have time to go and get all your vital signs. I mean, your horse has a broken leg. That is an emergency. Call your veterinarian right away. This is if the horse is lethargic, something's not right, and it's you're in that middle range. This isn't an obvious emergency, but it could be. So let me go take my vital signs. If everything's normal, then maybe you don't need to call your vet late at night or not. Okay. But, the AAEP on their article, When Should I Call the Vet? Again, the American Association of Equine Practitioners, they say check all the vital signs. It's one of the first things you should do, because that will tell you if something's out of the ordinary. So then that gets into the most obvious types of emergencies where you want to call your veterinarian. Like I said, a broken limb, absolutely, or a really gaping wound. I will say horses bleed a lot. They're huge. They're massive animals. But if there's like a gaping wound and they're bleeding, you need obviously to do some first aid, which we'll talk about here later in the podcast, but also call your veterinarian. Hey, the large laceration, front left shoulder, I need help. And the vet, that's an emergency, obviously. That's one of the things they have to do. But typically, the late night calls for our veterinarians, it's colic. And excellent podcast. If you haven't heard it before, I highly, highly suggest it. It could save your horse's life. Why do so many horses still die from colic? I taught the horse course on Coursera. It's still available. It's been going for over 10 years now. Over 100,000 students from 164 different countries. When I put that together many years ago. And I still have this email today when a horse owner wrote me and said, "You saved my horse's life. I took your course. When you talked about colic and the signs of colic, I realized my horse wasn't quite right. Started checking off the things you talked about in that class. And I told my barn manager, and they told me, don't worry about it. Horse will be fine." I didn't trust them. I called my veterinarian. Veterinarian came out, treated my horse, and said, "Thank you for calling me. You saved your horse's life." So colic is the number one reason veterinarians get called late at night. It's the most common reason for emergency call outs for veterinary surgeons. And this was a paper published out of the UK, indicators of critical outcomes in 941 horses seen out of hours for colic. And colic is the number one killer for our young horses under the age of 20. I mean, obviously, after age of 20, old age, obviously, at some point they're going to die because they get older. But colic kills more horses than anything on the planet. And basically, what colic is, if you're not familiar with it, it's stomach or digestive tract upset. So stomach, small intestine, large intestine, or hindgut. The large colon, cecum, small colon of the horse. There is something going on in their digestive tract. They have pain. If you suspect colic, call your vet. Period. End of story. Say, hey, I think my horse is colicking. And here's the signs. Here's the vital signs. And here is why I think they're colicking. And then the vet is probably, that vet that I talked about earlier. She's probably going to go put her jeans back on, her boots back on, she's going to hop in her truck and she's off to your farm because colic is so important to treat for horses. Now, interesting, out of that study, 941, they did post some of the vital signs. The heart rate for 2/3 of them were in that normal range, under 44 beats per minute. But for a third of them, it was over 50 beats per minute. One couple horses, 50 beats per minute. That's severe. That's a horse in severe distress. But as they go up with that, and that's some of the things that they noted in that article. Now, there's an excellent article on madbarn.com, 11 most common causes of colic in horses, plus how to prevent. You can go to madbarn.com, learn tab articles, just type in colic. All of them will come up. It's good to have this as a reference if you've never seen this before, because there's many different signs, and they can be mild, by the way. Doesn't mean that the horse isn't in severe pain. Horses are very good at hiding pain. And again, when we talked about personalities and other things, other factors, where some horses could be really gutting it out and they don't show some of these signs, whereas other horses are wimpy and they don't take pain well, and they're like, and I will say real quick, I don't need to hammer colic in this podcast, but 90% of colic cases are resolved on farm. That's why you want to call your veterinarian right away. They can come out, treat your horse, and hopefully don't have to refer them to a vet hospital. All right, but some of the signs: the horse is depressed. They isolate themselves from other horses. They're not eating. They're pawing the ground. They're rolling. They're sweaty in their flanks and their neck. They're nipping at their sides, trying to get at the pain. So you see tufts of hair. They're just not happy. Groaning, straining, all of that could be signs of colic. Manure is mucousy because it's just slow going through the digestive tract. Dry, hard could be signs of that. So, sorry, if you do suspect any type of colic, call your veterinarian immediately. Okay, so other injuries we talked about: bone fractures, any deep lacerations or lots of bleeding, any injuries to the eye. That is definitely an emergency for your veterinarian, because you don't want your horse to lose their vision. So that is for sure something that you would want to call your veterinarian out for. Things like snake bites. That's another one. If you go, especially where you live in the world, and your horse's face is swollen, or they have a large swelling somewhere in their lower limbs or on their body, that could be a snake bite. Obviously, that's an emergency. And typically it's in the face because the horse is like going down to eat, or it sees a snake and goes, "Oh, what's this?" and kind of investigates and gets bit. So that can happen too. So how do you respond to something like that? Like, my horse is bleeding profusely, or it has a broken limb, or needs some sort of first aid. This is probably going to be its own podcast in the future, applying first aid to horses. Actually, it will be, I promise you. We will put this together. But the biggest thing is, be careful, be cautious approaching an injured horse or a very ill horse. Always be on guard, because they may not be in the right mind, but especially if they're severely injured, they can kick out or strike and really hurt you. And again, if you get hurt, you can't help your horse, right? And get help. Get somebody else with you, because if something happens to you, then you need help, right? So just be very, very careful with that, but be very calm. You want to always approach their head, try to halter them. Whenever I've had really ill horses or horse down in pasture, you've been able to cautiously approach them, and then once you have your hands on them, you're able to calm them down. But you may need things like twitches. Um, you may need sedation, and that is where a vet can help you. Or it depends on where you live in the world. People can provide sedation. Hobbles you can do to prevent them from kicking, but you just want to be very, very careful, and then have your first aid kit, which I'll talk about at the end. So I just wanted to put that there, that whenever you find a horse down or in distress, be very, very careful. Be very, very careful. Other things. What if the horse is down and can't get up or stand? Okay, we'll talk about that in a second. What's a cast horse? Uh, or they don't want to move. They're just like, nope, I'm not moving, or very reluctant to move. Abnormal behaviors, right? It's things that aren't normal for them. That could be like, wow, okay, something's off. Then if I have a horse that's unable to move and no outward signs, I definitely would start taking vitals, trying to figure out what's wrong with this horse. And that's something that's way off. And it's worth a phone call to the veterinarian. That's an emergency. Now, what happens sometimes, and this can happen in pasture, typically it doesn't happen a lot, but it does happen in stalls where a horse could said to be cast. C-A-S-T. Now, what does that mean? That means usually if they're rolling in the stalls, it's a new stall or it's a small stall, they get stuck and they can't get up. And I will say here, if they're colicking, they can get cast because they're in so much pain or distress, they're rolling around the stall and they get stuck in somewhere where they can't get up. So beware of that. But sometimes it's just the horse doesn't get stuck and it's cast. And again, you want to be very, very careful. So when you read, what the veterinarian's advice is or horseman's advice is, you don't want to put on a halter and then yank their heads if they're cast. First of all, get help. Again, always have somebody to help you do this. If you just need to roll them on a side where they can get up, or if they're stuck in such a way that moving their head is required, don't put on a halter and yank their head, but grab their mane and maybe around their neck and just be very careful and moving them to get to where they can get up. Okay, but be very, very careful. And it's going to depend on the situation, where if you need to get ropes to bring them around and have people pull or help you. But again, be very careful. You don't want to injure the horse. You don't want to be yanking on their heads, and even like ropes, be very careful around their legs. You don't want to be causing worse injuries. You're just trying to get them over somewhere where they're unstuck and they can get up on their own. But again, that could be colic. So other things that the AAP said you should call for, severe diarrhea. So just out of the blue, this horse has severe diarrhea, not bouts of diarrhea or watery stools like we see in the spring when all the grass is lush and green and there's a lot of moisture in their diet, but like severe diarrhea, and you should know what that looks like in a horse because it's so abnormal. Again, call the veterinarian because dehydration is a big problem. And then, any high temperatures, just things that might indicate a fever or something bad's going there. And then respiratory distress. That's another one. They have trouble breathing, coughing, where they're just like, you can hear their lungs are raspy. That is, wow, okay, I need to call my veterinarian. That's an emergency. So when we talk about illness or the horse just suddenly just crashes, doesn't look right, don't hesitate to call your veterinarian. Again, get those vital signs. But this brought back a memory going through this list where back in Florida, when I was a professor there, and this was like 15 years ago, 2008. Oh, so that's 16 years ago. This title in the paper was Mystery Illness Kills 100 horses at a farm in Ocala, Florida. And all these horses started dropping dead and neurological problems, collapsing. And this was a large embryo transfer facility. So they had a large herds of recip mares. And I remember this specifically because I'd just gotten to Florida as a professor, it'd been my second year, and I was a reproductive expert. I was doing embryo transfers and things like that. Come to find out, they were, or what they suspect, I never did see the final report because this was a private enterprise, but they were feeding haylage, okay, which is when you take hay and ferment it, it gets moisture in there, and we feed it to cattle. Now remember, cattle has a large rumen where they can eat some of this stuff with toxins and bacteria, and the rumen will break all that down before it passes it on to the rest of the digestive tract. Horses do not. They have a simple stomach. Yeah, there's some acid in there to kill pathogens, but it doesn't kill them all sometimes. And when they have things like botulism, which can grow in haylage, horses will die. And over 100 horses died from this. And it was in the news all over in Central Florida. So again, if horse is not acting right, shows signs of neurological disease or something, could be their feed. It could be bad feed. And that's an emergency, right? So that's something you want to call your veterinarian. Okay. So switching gears, what are the non-emergencies? What are things that you could probably wait to the next day? And again, use common sense, but let's say your horse comes up lame. Not severe lameness, but just some lameness that you notice. And you give them some first aid or whatever, and they're not responding. Okay, that could probably wait to the next day to call your veterinarian and say, hey, do you mind coming, book an appointment? Um, just normal injuries that you get on farm. Punctures, I would be very careful. I would make sure your tetanus is up to date. Watch that because that can lead to deep wounds or infection. But strangles or just a slight illness where the horse isn't in severe distress, but it's starting to not look quite right. You could probably call first thing in the morning. Hey, do you mind coming look at my horse? Lymph nodes are swollen, maybe a slight cough, not severe distress, respiratory distress, but a little bit of coughing, maybe it's parasites, things like that. They're losing weight. They're not eating as much. Any skin conditions like saddle sores or things like that, or just anything that's subacute, it's not severe, you're not going to pull that veterinarian away from dinner or spending time with their families or watching their favorite Netflix show or something, whatever they want to watch on television. It's okay, I'll call first thing in the morning and then have the vet call me back and we'll talk about it. So again, use common sense. But one of the things in that article that the AEP put out was, if it was your child, how would you react? Would you call the pediatrician late at night because you're really worried? Or, okay, you're a little bit sick. I'll get you a little bit of medicine. We'll do some little bit first aid, but maybe we'll go to the doctor tomorrow just to do a checkup. Right. So that's a good rule of thumb because they are our children, right? Our horses are, they're our family. Like we love them so much. So again, use common sense. Now this is going to transition to telemedicine. What is this? This is how things are changing as technology advances. Our cell phones, and we can take pictures and videos, and we can video call now easily all around the world. We can talk. And as we worry about the workload on our equine vets, this is one way that their workload is starting to change. And I'll put it here too, the COVID-19 pandemic helped institute some of this because of lockdowns or because of social distancing and all these things that we all went through. Yeah. But, you know, doing medicine over the phone is something that's becoming more commonplace. We do it with our children. With my two young kids, we did it. We called and we were getting medical advice, whether we need to bring them into the doctor, whether we need to go to the ER, or just needed to give them some paracetamol or some Tylenol or something like that. So telemedicine is working in the human field, and now we're seeing it in the veterinary field. And this is where you're getting medical advice over the telephone. Many articles, you can Google this, telehealth or telemedicine in the horse industry. One was Embracing Telehealth in Equine Medicine, published just a couple years ago. And it said technology helps veterinarians improve treatment outcomes and provide life-saving advice to horse owners, especially in isolated rural areas. Remember earlier I said that I've gotten feedback that people out in the middle of nowhere don't have an equine vet and they have horses. And where are they going to get their horses treated? They have to trailer them all the way a couple hours away to the equine hospital. So that is a real problem. So this is where this is stepping in. Now, some big different words: telehealth, uh, telemedicine and teleconsulting. So telehealth is just the definition that I got off that article. A broad term that refers to the remote administration of medicine through technological means. In other words, practicing medicine while being physically removed from the patient. Now, there are some legalities with that I'm going to talk about here in a second. So, that is your veterinarian saying, do this to the horse, and they're that hour away or 2 hours away, and you don't have to bring them to the hospital. Telemedicine is using things like smartphones or apps or other services to transmit information. And then teleconsulting is consulting, where they're getting insight, advice regarding the medical care of a specific patient. So that's when you call them. You're on the telephone, you're teleconsulting, you're doing that already. The veterinarian's already telling you, giving you advice, but they already have that client patient relationship, right? So, or that client doctor relationship. So the veterinarian already knows you generally, and you have some sort of relationship. Now, the AEP published a white paper, and this was in 2018. So this is a little bit outdated after the COVID-19 pandemic, because things have rapidly changed since then. But their view on this is they have some concerns, and rightfully so. But telemedicine is something that, or using these technologies. So they talk about teleconsulting, which is vet to vet or vet to specialist. So let's say you have an eye injury with your horse. Your veterinarian can do some teleconsulting with an equine eye specialist. They can call that specialist at this university 2 states over, if you're in the US, or across Canada, or somewhere else in the UK, or wherever you are in Europe, or wherever you are in the world, and talk to that eye specialist and say, hey, this is what I have. What do you suggest? Now, the eye specialist will tell that vet, well, this is what I would do. And they're not seeing the patient directly generally, right? So they're consulting with the veterinarian. Telemedicine, again, this is where it's changing. This is the vet to client. So doing this over the telephone or these technologies. Tele-advice, again, that's what they're doing. Telemonitoring. So they're monitoring the patient. So maybe they say, hey, go take a picture or a video of the sutures. Please send them to me. Instead of the vet coming out to your farm and having to look at that horse, look at the sutures they put in, last week or whatever it was, you can send them a video and images, and then they can go and go, okay, it looks good. Okay, is there any heat? And they tell you what to do. So that's telemonitoring. Teleprescribing, that's where it's getting a little tricky, where they're prescribing medications, and again, there's some legalities in that. But this is changing, and just in the last year and a half, 2 years, there's still some skepticism. So again, this article, Embracing Telehealth in Equine Medicine, talking about the receptivity of it in the equine vet field. When they were at the Expo vet meeting a few years ago in Florida in 2021, this author asked the audience what they thought about telemedicine or telehealth. 50%, and this was primarily equine vets, had a good opinion of telemedicine. They thought it was a good idea. 40% said it's a bad idea. 10% were undecided. So they're very still skeptical. Now, again, you do have those older vets, right? And I bet you, I don't know, if you break it down by age, I bet you the younger generation is more keen on embracing this in technology, where if I was a veterinarian out there, my age, I mean, I love technology, but I would probably still want to get eyes on the patient. But anyways, things are changing, and we need to embrace this stuff, because our vets are overworked and we're losing them. We're losing the equine vets that start off in practice. So we need to embrace this stuff. Okay. Now, it's not going to replace your vet, telemedicine. So if there is, like, say, an after hours phone number you can call to get some advice, that's where I think this is going to step in and really help a lot. So there's many benefits of this. I mean, always talking about, reducing the workload of that, but also same day consultation for these rural places where they can't get a vet out. It could lead to better prognosis of horses, earlier treatments better. If there's things that a horse owner can do before a vet can get out to them, or before they load them on a trailer, if the horse is sick and stress them out for a couple hours getting to the hospital, if they can do this over phone or video chat or something, it's going to give better prognosis in the long run. And that's some of the other benefits they list. Addressing small problems before they become big problems, better prognosis. It saves time, it saves money, and the horse owner doesn't have to assume the burden of making health decisions. One of the things I keep seeing brought up in looking at embracing this is a lot of horse owners are Googling or watching YouTube like this to get medical advice. And sometimes the medical advice is not the best. It's not coming from an equine vet or a specialist in the field or somebody. Like, I've been doing this for 25 years plus, teaching, educating, learning about horses. I have a PhD. I've been a university professor. But if you just go and Google some videos on lameness in horses, you get 500,000 YouTube videos. And somebody out in the middle of nowhere talking about how to treat lameness in a horse that's not a vet or things like that. Okay. So that's where hopefully this can come in and help you. The benefits to the vet, there are benefits to this. They can be more vigilant, so they can monitor patients easier. Like I said, monitoring those sutures or other treatments. Send me a video of your horse. Let me just look at their behavior and see what they're doing. Again, improves the horse prognosis, improves their case success rate, and permits steady tracking of visual perimeters. Just talk about that. Looking at horses and stuff like that. Improves communication between client, patient, and then other professionals, and again saves the vet time. So that is something that I think that we're going to see more of. But again, that legality. So the AEP was a little. They're cautious in their approach, right? Because yes, I can send a video of my horse, but without you actually seeing, feeling, touching, hearing, getting all your senses out there with that horse, is that video serving that horse or giving that horse justice, right? So I think it's a tool, and that's how they're viewing it. It's a tool, but it's definitely not a way where a veterinarian is going to sit home all day on their computer and treat all their patients or deal with all their clients. They still need to get in their truck. They still need to drive out to the barn and see your horse, right? It's just some of this is going to help offset it. So yeah, I mean, you read through that white paper, and they're talking about they still need a valid relationship between the health professional and the patient, and it's very, very important. Now that gets into legalities. Where is this legal in the world? Well, if you look in the United States, there are certain states. So if you're not from the USA, each state has their own laws on top of federal law. So you have the United States of America law, then you have state laws, right? So in certain states in the USA, this is virtual vet care is illegal, like Texas, Utah, Nevada, Washington, Georgia, Tennessee, Mississippi. Other ones you can look, uh, where you can get this advice, but places like California, Arizona, and Idaho, it is legal. So telemedicine, some parts of it now, just there's certain restrictions. In Canada, almost all the provinces allow it. Alberta and Saskatchewan, they have to have a physical exam of the animal before they can give any advice over the telephone. So it is mostly legal there in Canada. And then if you go over to Europe, many countries in some sort of form, like in the UK, Spain, Portugal, France, Germany, Turkey, um, Finland, Sweden, Norway, there is some form of telemedicine available. So again, you have to look at where you live to see, but it's something that I think we're going to see change in the next 10 years. Now, also things to keep in mind as we wrap this up: what to have in your barn in case of an emergency. Need a first aid kit. Make sure you have your veterinary phone numbers. Make sure you talk to your vet. What if I can't get a hold of you? Who do I call? Ask them. They will tell you. And then get a backup to that backup, right? Have a backup. That's just how I roll. That's how I think. So I would have at least 3 contact numbers. Okay, if I can't reach you, who do I call? If I can't reach them, who do I call? Okay, then one of those should pick up in case of emergency. Name name and phone numbers of friends or family that can help you. Again, have that listed somewhere in your facility. Directions to a referral center. So if you need to take a horse to your vet hospital, where's the nearest one? Trailering, how to trailer, where's it at? Cars, all of that. Emergency evacuation plan, just covered that last week. Please watch that. That's another podcast that's a must for any horse owner. And then in your first aid kit, oh my goodness, this is going to be a whole nother podcast, but vet's phone number, regional map, stethoscope, thermometer, scissors, flashlight batteries, a bowl, unbreakable that you can rinse things in, clean syringes, latex gloves, bandaging material, which vet wrap, rolls, elastic wrap, tape, duct tape, all this stuff, antiseptic scrub and solutions like betadine, sterile saline, hemostats for picking stuff from wounds, pliers if you have nails in the horse's hooves, splint materials if you're going to splint a leg. Again, I would not do that without any training, but be very careful. So things available, especially if your vet shows up. Eye ointment. Okay, again, don't treat anything until you talk to your veterinarian. Diapers or other absorbent pads, and clean syringes. That's just some things you can put in your first aid kit. I know that was fast and furious, but we'll have a whole nother podcast on that here in the near future on what should be in there and how to treat some basic stuff and then when to call your vet. My best advice in all of this at the end of this podcast is speak with your veterinarian. Okay. If I have an emergency, who do I call? What do you think is an emergency? Signs of colic, all of these, obviously the most obvious ones. What if my horse is just sick, a little bit sick? They may say, send me a text. Just send me a text message. They'll have a preference on way to contact them. But have this discussion with them. And, if you don't have a specific veterinarian, find one and develop a relationship with them. Okay. And if you're one of those rural owners, find the nearest one and just start talking to them over the phone. Hey, and try to meet with them at some point or see if they can get out to your facility. Okay. But also recognize what is an emergency, what isn't an emergency, and, be prepared. Preparation's always important. So thanks for watching. If you haven't yet, if you don't mind hitting that subscribe button, thank you. It shows that you're really appreciating this content. And check out madbarn.com. Lots of resources on there, over 500 articles. And any comments, or if you're a veterinarian or you've had experience in this, email me, podcast@madbarn.com, and I'll get back to you. But thanks for watching and listening, and stay tuned. We got more content coming your way.